Cat scratch disease, or CSD, is an infection caused by Bartonella henselae, a bacterium commonly found in cats. Many cats carry it without showing any signs of illness. While CSD is typically mild, it's important to be aware of its causes, symptoms, and prevention. Cats usually get infected through flea bites or contact with other infected cats. Once a cat is infected, it can carry the bacteria for months or even years. Most cats with Bartonella henselae don't show any symptoms, making it difficult to know if a cat is carrying the bacteria. This is why it's crucial to practice good hygiene and take precautions when interacting with cats, especially if you have a weakened immune system. CSD is more common in children and adolescents, likely because they are more likely to play roughly with cats. However, anyone who has contact with cats can get CSD. Understanding these basics can help in preventing the disease. Please, subscribe now to join our community. Give a thumb to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, MedSign Health 360, has many more videos to bring the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We would love to hear your feedback and encourage you to share your thoughts in the comments below. The most common way CSD is transmitted to humans is through a scratch or bite from an infected cat. Even a small, seemingly insignificant scratch can transmit the bacteria. It's important to note that CSD is not contagious from person to person. However, in rare cases it can be transmitted through blood transfusions. If a cat licks an open wound on a person's skin, the bacteria can enter the bloodstream. Handling cat fleas and then touching your eyes or mouth can also potentially lead to infection. Not all cats carry Bartonella henselae, and not all scratches or bites from infected cats will lead to CSD. It's essential to take precautions and seek medical attention if you suspect exposure. Awareness and prompt action can mitigate risks. Cat scratch disease typically has an incubation period of 3 to 14 days. The first noticeable symptom is usually a small red bump or blister at the site of the scratch or bite. As the infection progresses, the bacteria travel to the lymph nodes, causing them to become swollen and tender. This swelling typically occurs 1 to 3 weeks after the initial scratch. The swollen lymph nodes can be painful and may feel warm to the touch. They can vary in size from a pea to a golf ball. Other common symptoms of CSD include fever, fatigue, headache, and loss of appetite. Some people may also experience muscle aches, joint pain, or a sore throat. These symptoms are generally mild and tend to resolve on their own within a few weeks. Recognizing these symptoms early can help in managing the disease effectively. Diagnosing cat scratch disease usually begins with a thorough medical history and physical examination. Your doctor will ask about any recent contact with cats, especially scratches or bites. They will also examine the site of the scratch or bite and check for swollen lymph nodes. In most cases, the doctor can make a diagnosis of CSD based on the clinical presentation alone. However, laboratory tests can be helpful in confirming the diagnosis, especially if the symptoms are atypical or severe. Blood tests can detect antibodies to Bartonella henselae. In some instances, a biopsy of a swollen lymph node may be performed. The presence of certain characteristic changes in the lymph node tissue can confirm the diagnosis of CSD. Early diagnosis can lead to better management of the disease. Preventing cat scratch disease primarily involves minimizing the risk of cat scratches and bites. Regularly trimming your cat's nails can help reduce the severity of scratches. Discouraging rough play with your cat can also help prevent scratches and bites. Instead of using your hands to play with your cat, opt for toys that keep your hands at a safe distance. Teaching children how to interact gently with cats is also crucial. Controlling fleas is another important aspect of prevention, as fleas can transmit Bartonella henselae between cats. Consult with your veterinarian to determine the best flea control regimen for your cat. These steps can significantly reduce the risk of CSD. Most cases of cat scratch disease are mild and resolve on their own without specific treatment. Treatment typically focuses on relieving symptoms. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help reduce pain and fever. Warm compresses applied to swollen lymph nodes can also provide relief. Antibiotics are not routinely recommended for uncomplicated CSD. However, in severe cases or in individuals with weakened immune systems, antibiotics may be prescribed. The prognosis for most people with cat scratch disease is excellent. Symptoms usually resolve within a few weeks. and there are typically no long-term complications. Prompt medical attention can ensure a smooth recovery.